Okay, so we continue with the large intestine. Um, we completed the small intestine. We looked at the duodenum, the jejunum, and the ileum, and the root of the mesentery. And we discussed extensively the differences between the jejunum and the ileum. Okay, now we want to look at the large intestine. Not much. We want to talk about the large intestine. The large intestine is basically responsible for the absorption of water, right? And it's basically what goes on in the large intestine. Plus, you can also have the absorption of some important vitamins in the large intestine. But we want to look at the gross anatomy of the large intestine and see the differences or what distinguishes the large intestine from the small intestine. So we have here as your cecum, that's the cecum, all right, and that's the ascending colon. And that's the transverse colon, and this the descending colon, the sigmoid, and of course we have the rectum, and the anal canal. So let me complete this. That's the transverse colon. Okay. This is the cecum, which is about 7.5 in both breadth and in length. All right. And of course, we have the appendix there, and we have superior to that opening of the appendix is the ileum, and that's the ileocecal junction. Okay? Now, the distinguishing features of the large intestine from the small intestine are the presence. Oh, by the way, before we go into that, the large intestine is comprised of the cecum, okay, the ascending colon, the transverse colon, as the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anal canal. All right? Now, some of the distinguishing features of this is the presence of, we have this longitudinal band. Here's a longitudinal band that runs that runs vertically, okay, and continues transversely, and of course they also continue descending downward, following the course of the large intestine. So these bands are described as tenea coli. They're described as tenea coli. It's a very important distinguishing feature that you find in the large intestine. The other thing you find in the large intestine are presence of these things that looks, it's actually called omental appendices. These are omental appendices. Omental appendices. All right. They are attached to the tinea coli. Okay, so the other distinguishing feature is the omental appendices. So that's the first thing. Second is the omental appendices. Number 3 is a hystra. That's the hystra. Now, the hystra is formed as a result of the tightening band of the tinea coli that brings together these kind of shapes. So these shapes, all right, are called hystra, and that is because these bands here causes these to tighten up and gives it this bulging. So these are called hystra. They're called hystra. All right? Now, good. There are 3 types of tinea coli. Right here, we can see it's clear. There is this tinea coli that the transverse mesocolon and sigmoid colon attaches to. So they are called the mesocolit tinea. So there are 3 types of tinea coli. The first is the mesocolit tinea. And what is this? It is because the transverse mesocolon attaches to this portion of the tinea coli. The transverse mesocolon attaches to this portion of your tinea coli. That's the first type of your tinea coli. The other type of your tinea coli is the omental coli, the omental tinea. The omental tinea is that portion of the tinea coli that the omental appendices attaches to. These are the omental appendices. And then finally we have the free tinea coli. So these are part of the tinea coli that neither the mesocoli nor the omental, the mesocolit tinea or the omental tinea attaches to. So those are the 3 types of tinea coli. Now these are distinguishing features that you find on the large intestine that you don't see in the small intestine. Very important to note is the appendix. The appendix is approximately 6 to 7 centimeters long. It is an example of a blind diverticulum, an outpouching of the cecum. So it has an opening there, okay, and it is posterior medial in the cecum, inferior to the ileocecal junction. Now it has its blood supply and mesentery. All right. The mesentery is described as mesoappendix, and the artery that supplies the appendix is the appendiceal artery. The appendiceal artery is a branch of the ileocholi artery. The ileocholi artery is a terminal branch of the superior mesentery artery. The appendix, which is also described as a vermiform organ, because probably it doesn't have a function, but it's been shown that there are lymphoid tissues in the appendix, so it has a function. However, the appendix can be of clinical importance, that is, in the case of acute appendicitis, which will be part of what we'll be discussing when we start to talk about clinical anatomy of the gastrointestinal tract. Until then, have a good day. Thank you.